Pain is one of the most common reasons people seek medical attention, and pain is subjective. You may have had an injury or illness that was extremely painful for you, but for someone else it might not be as bad.
Ow.
Sometimes pain can be so intense that it means that something really bad is happening to your body. This is what we call a medical emergency, and you need urgent treatment to stop what's happening, or to reverse any damage that has been done. In this video, we will go through 7 pains that you should never ignore, because they could be a sign of something serious going on in your body. So let's get started. Abdominal pain. Abdominal pain can be caused by a huge variety of different things, from indigestion to appendicitis. Appendicitis is where the appendix becomes inflamed, and it is one of the most common acute surgical emergencies. The pain starts off as a vague abdominal discomfort that comes and goes. But if left untreated, the pain gets worse and becomes constant. It typically comes on suddenly and is located around the belly button and migrates to the right lower quadrant of the abdomen. If you think you may have appendicitis, you should seek medical attention urgently, because if it ruptures, it can cause a serious infection in the abdomen called peritonitis. Treatment usually involves antibiotics and an appendectomy, which is the surgical removal of the appendix. Chest pain. Chest pain is another reason that people often need urgent medical treatment. When you have chest pain, it's important to ask yourself whether it might be coming from your bones, muscles, heart, lungs, or other structures like the esophagus or the aorta. Heart-related chest pain, also known as cardiac chest pain or angina, is a symptom of coronary artery disease. Coronary artery disease is when there is a blockage in the arteries that supply blood to the heart muscle. This can be caused by atherosclerosis, which is where fatty deposits called plaque build up inside the arteries. If you think you might be having a heart attack, you should seek urgent medical attention. Not only is this the most serious pain that you can experience, but it is also time-sensitive. The sooner treatment is given, the better the outcome tends to be. Treatment can include medications like aspirin, nitroglycerin, and morphine, as well as other therapies such as angioplasty and coronary artery bypass graft surgery. Shoulder pain. Shoulder pain can be caused by a variety of different factors, including injury, overuse, arthritis, and certain medical conditions. However, shoulder pain can sometimes be a symptom of something more serious, such as a pulmonary embolism. A pulmonary embolism occurs when a blood clot, also known as a thrombus, gets lodged in an artery in the lungs. This can cause a sudden onset of sharp stabbing pain in the shoulder, especially on the right side. Other symptoms can include shortness of breath, rapid heartbeat, and a cough that may or may not be producing blood. If you experience these symptoms, you should seek medical attention immediately. Early diagnosis and treatment of a pulmonary embolism are crucial to prevent further complications, such as a stroke or heart attack. Sudden weakness or numbness. Sudden weakness or numbness in the face, arm, or leg can be a sign of a stroke. A stroke happens when the blood supply to part of the brain is interrupted, causing brain cells to become damaged due to lack of oxygen and nutrients. This can lead to a number of symptoms, including numbness, paralysis, confusion, difficulty speaking, and loss of balance. If you or someone you're with experiences these symptoms, you should seek urgent medical attention. The faster that treatment is given, the better the chances are of limiting the damage caused by the stroke. Treatment options may include medications to dissolve the clot blocking blood flow to the brain, surgery to remove the clot, and rehabilitation to help with recovery. Sudden severe headache. Severe headaches can be caused by many things, from tension to migraines to sinusitis. However, if the headache is sudden in onset and is accompanied by other symptoms, it could be a sign of something more serious, such as an aneurysm. An aneurysm is a bulge or ballooning in the wall of a blood vessel, which in this case would be an artery. If the aneurysm ruptures, it can cause bleeding in the brain, which is known as a subarachnoid hemorrhage. This can be life-threatening and requires urgent medical attention. Other serious causes of headaches include cerebral venous thrombosis, which is a blood clot in a vein in the brain, and meningitis, which is inflammation of the membranes that surround the brain and spinal cord. These conditions require urgent treatment with intravenous antibiotics or other medications to reduce inflammation and prevent further complications. A sudden onset of shortness of breath. Being short of breath can be uncomfortable and even frightening, but it is usually not a cause for concern if it happens gradually over time. However, if it comes on suddenly, it may be a sign of something more serious, such as a pulmonary embolism or a tension pneumothorax. We already talked about pulmonary embolism earlier, but a tension pneumothorax is when air gets into the pleural space between the lungs and the chest wall. This can cause a collapse of the lung and a buildup of pressure in the chest cavity, making it difficult to breathe. This is a medical emergency that requires urgent treatment with a needle to release the air from the pleural space. Other serious causes of sudden shortness of breath include heart failure, where the heart is unable to pump blood effectively, and cardiac tamponade, which is when the heart is compressed by fluid buildup in the pericardium, the sac around the heart. These conditions can be life-threatening and require immediate medical attention. Back pain radiating to the buttock. Back pain is one of the most common reasons people seek medical treatment. It can be caused by a variety of factors, including poor posture, muscle strain, and disc degeneration. However, back pain that radiates to the buttock and is accompanied by other symptoms, such as numbness or weakness in the legs, may be a sign of something more serious, such as a herniated disc. A herniated disc occurs when the soft inner part of an intervertebral disc pushes through a tear in the outer ring of the disc. This can put pressure on the spinal cord or the nerves in the spine, causing pain, numbness, or weakness in the legs. If left untreated, a herniated disc can lead to permanent nerve damage. Therefore, it is important to seek medical attention promptly. Treatment options may include physical therapy, medication, or surgery to remove the herniated disc fragment. When to seek medical advice? It's always best to err on the side of caution when it comes to pain. If the pain is severe or persistent, it is always a good idea to seek medical attention. Pain is subjective, and what may be tolerable for one person may be unbearable for another. Ultimately, the decision of whether or not to seek medical attention for pain is a personal one that should be made in consultation with a healthcare professional. It's important to note that while these pains are potentially serious, they do not represent all possible causes of pain. There are many other medical conditions that can cause pain. If you have any concerns about a pain you are experiencing, it is important to seek medical attention. Early diagnosis and treatment of a medical condition can make a significant difference in the outcome, particularly in cases of medical emergencies. We hope this video has been helpful in providing information on some of the pains that you should never ignore. Remember, it's always best to seek medical attention if you are experiencing severe or persistent pain. Thank you for watching, and please like and share if you found the video useful. Stay healthy and take care.